Before COVID-19, Nigeria used to send its Lassa fever samples to a World Health Organization reference laboratory in Dakar, Senegal, for testing. But within the first 6 months of the pandemic, Nigeria has improved on its molecular diagnostic capacity, building 71 laboratories across 35 states of the Federation and the Federal Capital Territory. The country recorded its first case of coronavirus in February 2020. But as the infection rate increased, there was a fear that Nigeria's response will be hampered by its poor health facilities, highlighted by lack of laboratories to test suspected cases, and isolation centers with inadequate bed spaces. For a discussion around how Nigeria has responded to this situation, we are now being joined by Dr. Chikwe Ihekweazu, Director General, Nigeria Center for Disease Control. Good morning, Dr. Ihekweazu, and welcome to the program.
Thank you, Ruben. Good morning. Good morning to you, to Dun and Rufai. Excellent work your team is doing.
Thank you, Doctor. Good morning.
Thank you. So, well, this morning, our correspondent on COVID-19 giving us the daily global update pointed out that there have been reports that Nigeria is already flattening the curve. Is this really true? And he cited the example of 4 states, Borno, Kebbi, Zamfara, and Kogi, where in fact there has been no case of infection or fatality in the last 23 days. Is this really the reality, or is it because we're not testing enough?
So thank you, Ruben. Thank you very much. It's a very important question, one we've been examining. The data is what it is. We are having fewer cases reported than we had in April, May, and the numbers are what they are. The states where we at NCDC are most comfortable with, actually, are not the states you mentioned. The states we are most comfortable with are the states like Lagos, FCT, Kano, Borno, that are testing a lot and not finding as many as they used to find. So a few months ago, we used to have a test positivity ratio of up to 20-25% in Lagos, i.e. 20% of all the samples we collected were positive. Now that figure is down to 5%. So we're happy with the progress made in Lagos. In some other states, many of the ones that you mentioned, they are not testing enough. So that you're not finding cases, it's impossible for us to say whether that's a reflection that there are really no cases or just a reflection that you're not testing. So we've been reaching out to states saying, listen, this national curve that we show every week, every day, is really a reflection of several sub-national curves. And some states have reacted positively and started testing more. A perfect example of that is Plateau. Initially very slow, but now they started testing more. Yes, they found more cases, but that's a good thing because now they know where they are. But many states, unfortunately, haven't learned from that, are not testing enough, are not finding enough, and are kind of driving blind. And I am very worried that we might find an explosion in those states that will then affect the rest of the country again. So we keep, as we've rolled out our labs, increased testing capacities. Every week, teams from NCDC around the country supporting states to scale up their testing. But ultimately, the sample collection efforts, the mobilization efforts within states have to be driven by states. And until they find the benefit and see the benefit of testing more in order to define for themselves where they are, we will be in this position of not having full certainty of where we are in the trajectory of the outbreak in Nigeria.
Thank you, Doctor. So those reports that are coming out that Nigeria might experience a second wave is what I'd like you to discuss now. In the 7 months since we had our first case of COVID-19, any assessment to be done of our progress with this pandemic really shouldn't be done in broad strokes. We should, as you've just highlighted, look at it at a sub-national level because some states are stronger than others. In the event of a second wave, which we all hope to avoid, do you advise at this point that there would be a national lockdown, or would it depend on what the hotspots are, as has been done in other countries?
Yeah, that's a very good question. You see, all of us are trying to avoid a lockdown, not just in Nigeria, across the world. You find countries working very hard to find ways to avoid a lockdown because we've all seen what it can do to our economy. I think the impact of this outbreak on the Nigerian economy will be felt for years to come. So we've got to try to avoid that scenario again. But avoiding that scenario means moving away from almost a government-led response to where others take a little bit more responsibility. We know that as we move towards reopening our schools, that there will be increased opportunities for transmission because students will come together. We know that with opening our airspace, we have opened ourselves up to some increase in infection, and therefore we carried out fairly stringent mitigation measures. You know, the testing before you come in, the testing on arrival, all those are painful decisions. But what is the alternative? To close the airspace? No. So we need Nigerians to really see that this is really not something any government can do on our own. We see a lot of easing up of insistence on these measures by institutions that have the capacity to insist on it. Let's leave the people walking on the streets. But let's talk about banks. You know, I go into a bank now, I see fewer people wearing a mask, yet there's a manager in that bank that can insist that these measures are carried out. You go into our religious places, you know, people are not wearing masks anymore, yet there's a pastor or someone in charge that can implement this. So we really need everyone. The second wave is not inevitable. We can avoid it, but it can't be done by government lockdowns. It can only be achieved in a sustainable way if we come together as a society. To be honest, nobody in this country wants another lockdown. And we're hoping that we have learned enough from the consequences of the first one to prevent the second one. But there's no way we can eat our cake and have it. We can't open up flights, open schools, open workplaces, and not have infections without doing something. So something has to give. What has to give is that we, as the people, have to come in and do our bit, just a little bit more, to buy us some time until we get to that point where we do have a vaccine. And when we do have a vaccine, we need some time to distribute it across the country to all that need it.
Okay, I've got three quick questions because things will wrap up now. Number one will be, they shut down 2 isolation centers in Abuja. Is it an indication that everything is okay? Secondly, I want to talk about testing. How well have we done as regards testing? And how well have we done as regards, the vaccine production points, in this country? Even if the vaccine comes, where are we going to produce? Where are we going to do randomized trials and things like that? Just 3 insights quickly.
Okay, 3 good questions. On the treatment centers, we have scaled down the numbers. The FCT has scaled down. The Lagos state government has also scaled down because we are just not seeing the number of serious patients that we saw 3-4 months ago. We've kept a few. The dome is there. Lots of space available for new patients. So we have some redundancy plans. So at the moment, we're kind of mitigating our work. We just opened a new center in the University of Hospital for very severe cases. So it's not like we're shutting down and pretending to go away. No, we're kind of strategically moving step by step to where we need to be. On testing, I think one day a story will be told how we have been able to scale testing so quickly in Nigeria. However, what we have done in the short term is build on what we have. But we do have a long-term plan now to make sure that in every state we have a solid PCR lab that can work not only for COVID, but for all the other viruses that may emerge. So that's work that is ongoing, working very hard with all the state governments and sometimes universities. Finally, your point about vaccines. The most important thing, short-term goal for vaccines is access. And we are part of a global coalition called COVAX that is working very hard to ensure equitable access across the world. And so once these vaccines firstly become available, what do I mean become available? There are 2 important criteria for vaccines. Efficacy, i.e. if they work, and safety, if they're safe, right? And once this is proven, and we hope to get that data by end of the year, then the next big issue is production capacity. We don't have a lot in Nigeria. Most of the production will likely happen in India and a few other countries. Then the third aspect will then be the distribution. And that's where we really have a lot of capacity. You know, we have a long history of delivery of vaccines because we've had a lot of campaigns for polio and a lot of other vaccine preventable disease. Our sister agency, the National Primary Healthcare Development Agency, is very well coordinated in distribution. So there's a whole chain of activities going on, led by the Honorable Minister of Health. And we're very confident that once a vaccine becomes available, we will play our role in making sure we get it as quickly as possible to every Nigerian that needs it.
All right, thank you
very
so
much.
Thank you so much, Dr. Ihekweazu.